Whether you've pulled an all-nighter or just couldn't fall asleep, having low energy levels during the day can really throw off your productivity. And though a coffee or energy drink can be a much-needed Band-Aid for the situation, not everyone can use such a simple fix. Cancer patients often experience more severe fatigue that's much more difficult to treat. It's partly due to chemotherapy, which lowers blood cell counts and kills off immune cells, contributing to feeling extra tired. And even after the treatment is done, Dr. Sung Choi says the various medications they still need can drastically disrupt their sleep. And sadly, compensating during the day for lack of sleep at night often backfires.
They like to sometimes keep their rooms dark, even when you need the light to sort of reset their clock. They like to just stay in their room and they'll keep their rooms dark. They're not getting sort of the things that will naturally set their cycle. And so I think you just get into this loop where you then stay up later, you're sleeping in later, and then you're not walking or eating at set times.
Choi is a pediatric oncologist, bone marrow transplant physician, and professor of pediatrics at the University of Michigan. Aside from the frustration that comes with chronic fatigue, not getting adequate sleep can have harmful effects on our health. Olivia Walsh, CEO of the biotech company Arcoscope, says that getting the recommended 8 hours is only the tip of the iceberg.
You can put people on schedules where they get less than 8 hours a night, and they tend to get worse and worse at things like adding, subtracting, immunity from colds, mood. It's not good to have a low sleep duration. But an important part of sleep health that most people aren't thinking about is sleep rhythmicity, the rhythm of your sleep, which is funny because we think about rhythm in lots of other biological contexts, like breathing. It's good to have regular breathing versus fast, fast, slow. Heartbeats, absolutely. Rhythm is central to our definition of health for your heartbeat. If it's arrhythmic, that's bad. But for sleep, we tend to focus on this 8 hours. And as long as you're getting 8 hours a night, we don't usually care so much about when that happens. But it's starting to change.
In fact, research is showing that sleep regularity is a stronger predictor of negative health outcomes compared to time spent asleep. A 2024 paper in the journal Sleep suggests that having a consistent sleep schedule could be one of the simplest ways to improve your general health. Walsh says this emerging research underscores the importance for paying attention to our circadian rhythms.
Your body's internal clock controls your sleep. It controls a lot of other things as well. And when you have irregular sleep, your body doesn't have a clear sense of when day is and when night is. And as a result, it kind of tries to do everything all at once. You can totally get stuck in this feedback loop where you don't get light at the times you need it. And so then you're up at times when you should be asleep, you should be avoiding light, and then you're tired the next day. So you sleep in and you miss out on the light again. And so it's this sort of horrible cycle where it's really hard to break out of it, especially if you don't think light matters. And lots of people, including me in the past, didn't think light exposure and timing mattered to health. I was sort of in this framework of 8 hours a night, and that's it when it came to sleep health.
But now, Walsh is working to fight fatigue by correcting the body's internal clock, instead of throwing medication at the problem. Her company has created an app called ArcaSync that uses an Apple Watch to track a user's circadian rhythm, then gives personalized feedback to reduce their daily fatigue. Choi is excited about the possibility of helping patients through behavioral changes instead of adding another drug into the mix. Walsh, Choi, and Caleb Mayer, along with other collaborators, recently published a paper in Cell Reports Medicine that shows this app can significantly decrease daily fatigue, anxiety, and sleep disturbance. They saw improvements in all 3 groups of patients studied, which consisted of people with either prostate cancer, breast cancer, or blood cancer. The app helps get users back in the practice of hitting cues throughout the day that set up their circadian rhythm.
What are these cues? It's the light, it's breakfast, it's walking, interacting with people. And when you're missing all of them, it can further compound and sort of worsen fatigue as time goes on.
These cues are timed differently for everyone, depending on how you want your day to go, which made building this app tricky. Mayer was responsible for creating the algorithm that collects and analyzes user data, then responds with personalized feedback. There were various challenges, but one unique to cancer patients is that their data will look different than a healthy 20-year-old's. So Mayer, a postdoctoral scholar at Stanford University, had to figure out how to make sure the app was tuned to this specific community.
Wearables can capture a kind of wide array of different behavioral and physiological signals. Those are impacted obviously by our circadian rhythm, but by a lot of kind of external influences as well, right? So it's kind of, we have to parse out kind of which of these are reflecting the circadian system versus just reflecting like individuals taking a bike ride, going on a run, just different behaviors throughout the day.
Mayer's algorithm captures a user's activity patterns and heart rate to tune to their circadian rhythm. For their paper, the team gathered user data for a month before making any recommendations to make sure the app had an accurate picture of the individual's internal clock.
It's non-invasive. We don't have to poke them with any needles. It's just what they're wearing on their body. They're not even thinking about it. And the data is just being collected. And they use this fancy mathematical algorithm that can then, based on those features, make recommendations of what to do.
Since everyone's internal clock is unique, the team had to make sure that their app is able to recognize what an optimal day looks like for each individual. The algorithm allows the recommendations to be tailored specifically to each user's lifestyle and goals.
If somebody loves waking up at 9 a.m., I really don't have a scientific justification to say, no, you should wake up at 7 a.m. But it's going to change my recommendations for what they should do, especially if they're chronically waking up, let's say, earlier than 9 a.m. And if they're chronically waking up earlier than 9 a.m., but that's their goal, what I would probably tell that specific person to do is avoid light in the morning in order to delay their rhythms and make it so that they naturally wake up at 9 a.m. For somebody else who's really wishing they could wake up earlier and that's their goal, then I'll say, yeah, like we're going to get you bright early morning light to shift you earlier so that now you're naturally waking up at 6 or 5 a.m. when your goal time is.
The recommendations can also vary day to day, depending on how your activity levels shift. Part of the goal is to increase the user's circadian amplitude. This is basically a measure of how much your rhythm goes up and down throughout the day.
So if you've got a really high amplitude melatonin rhythm, I would say that if I'm looking at your body producing melatonin, which is what people's bodies do once a day, even if you don't fall asleep, if I keep you up in a room all night, your body is still going to produce melatonin. And it looks like nothing, and then a really strong rise. It peaks and then it goes down again, and it's really clear. But somebody with a low circadian amplitude, we could bring them into the lab, we could start collecting their saliva, and you look, and it's just no clear rise time. It's maybe a few spikes here and there, but it's barely nothing. They've basically flattened that circadian rhythm, and it's low amplitude.
In other words, having high amplitude means your body definitely knows when it's nighttime and time to start producing melatonin. Having a flattened circadian rhythm causes confusion. The body has no idea when to make you sleepy, so it won't produce much melatonin at all. Thankfully, you can train your body to have high amplitude and get your cycle back on track.
We can predict whether actions you take will make your amplitude higher or lower. And so we've done this with disrupted people where we kind of let them do whatever they want. And then we use our model based on what they did to say, okay, did your amplitude go up and down? And then we can correctly predict it. But the sort of theoretical way for maximally boosting amplitude is what we did in this sync study with cancer patients, where we said, get a ton of light, especially in the middle of the day, and then get the darkest dark you can at night and be really, really consistent about this.
The app also recommends when a user should be eating or not eating as another cue to the body of daytime versus nighttime.
And so we say, hey, this is the window of time today for you that we think is going to be best to eat during. Then as the day goes on, we'll say, hey, start dimming the lights. Often we do this earlier than people are prepared for, especially during daylight saving time. We're like, listen, dim the lights. Your body's trying to produce melatonin, and every minute you're still in the light, it's not going to do that. Your body suppresses melatonin in the presence of light, and we want to get your rhythms high again. We want to boost your amplitude. So dim the lights. And in our trial, we actually gave people blue blocking glasses to help them do this.
The algorithm will also calculate the most realistic time users will be able to fall asleep. With the success of the cancer patient groups in Walsh's study, she's hoping to expand this technology to help more communities. A recent feasibility study in kids revealed that it could help reduce their fatigue, and early data from an ongoing trial is showing that patients with multiple sclerosis are finding similar benefits. As she looks towards the future, Walsh has her eyes set on using ArcaSync to reduce preterm birth.
The same kinds of algorithms can help us track and boost circadian rhythm, circadian amplitude in pregnant women. And there seems to be a lot of connections between schedule irregularity, low circadian amplitude, and fertility and preterm birth. And so our hypothesis is that if we can get people to be on a really regular schedule with their lighting and their eating, which when you're pregnant, you're up at night, it can be hard, but if we can just start to make people appreciate and gamify this stay regular intervention, that we can make it so at-risk women don't deliver as early as they otherwise would have.
Along with this goal, future research will look at the best time to take medications during the day and the sex-based differences in amplitude. ArcaSync is available now to download in the App Store or Google Play. You can find more information about Dr. Sung Choi, Olivia Walsh, Caleb Mayer, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.